Raymond and Eclipse, and thanks for inviting me. As you can see today, I'd like to talk a little bit about. Oh, I was asked not to move that much, so I go back to be kept by the camera. So today I would like to discuss with you. So I see it as an institute seminar. So it's not only that I present facts; it's also about discussion. Please feel welcome to raise questions to get into discussions with me. I would like to talk about adolescent health information seeking behavior, and specifically about the processing skills that are necessary to navigate through a very complex information environment. So I will not only focus on the skills, on the individual skills, I will also focus, let me find the right one. Let's go this. I will also discuss a little bit the public health strategies to address the digital determinants of health. You see, I will broaden a little bit the presentation later in a later stage. That could be also helpful to mitigate or to address and to fight against the misinformation and disinformation problem that we have, especially also for adolescents. So these 4 points I would like to suggest to talk about. I know I have 35, 40 minutes, something like that. And the colleague is so nice to give me a sign when I'm speaking too long and too much. So let's dive into it. First of all, I've brought a little example with me. I've constructed it, so I wrote it down, but actually it could be a real case that I just present you. This is the case of Lena. Lena is 60 years. And Lena is used to be quite outgoing, extroverted, you could say, but during the last months, she's a little bit tired. She's exhausted in a way, and she's unmotivated, and she sees all this reason in herself. She thinks she might be too lazy. She might be, whatever happens to her, it's her fault. She's not seeking for professional advice and professional support. Instead, what she's doing is she scrolls. She uses her mobile to get information, and she stumbles across a TikTok post that says 5 signs of depression. And when she reads the comments under the post, she can read quite different comments like, this is normal, this is just poverty, do more sports, it will help you, or nothing will help you. And what she is confused about that. And she's not doing anything, she just keeps on with scrolling. So you might think this is a little bit to overemphasize the example, but I'm not sure about it. So I think a lot of young people have some problems in dealing with health information when they are online. And one point that I would like to make now is to dive a little bit deeper into digital media use and information seeking behavior. And one study I would like to show you here is a study that has been published last year. It's the so-called YEP study. This stands for Youth Empowerment and Participation. It has been conducted in Austria and in Germany with a representative sample for both countries. You see here 14 up to 25 years. And one of these questions were, where do you learn about mental health? And you can see top ranked is social media, so TikTok, Facebook, etc. So as Hayo said, I'm very much into school health promotion. So I was a little bit disappointed to find the school very much in the bottom of this figure. But there's also another question that has been posed to the young people. Where would you like to learn more about mental health? And here the school is ranked top. So obviously there's a gap between where they learn more about mental health and where they would like to learn more about mental health. So actually they seek information online, especially on social media. And when you look at these country differences, you see that for German young people, this is more common to use social media to find more about mental health. I will go a little bit back to the question, this is an obvious question, of course, how much are digital media used for information seeking in general? And this is the GIM study you're all aware of, the Jugendinformation Medien study that is conducted every year. And what I took out here is the year spent from 2018 to 2024. And what you see here is the minutes young people spend daily online. And of course, you see a little bit a rise and a fall, but it's around 3 hours and 30 minutes, so 3.5 hours per day. And actually, it might be more than this, because this is a subjective assessment of the time that is spent online. Other studies, like the Postbank Use Digital study, came up with this 72 hours per week that all adolescents, 16 to 18 years, spend per week online, especially using these digital media like smartphones and tablets, so mobile devices especially. So it's somewhere in between, I would say. So, but I think we can agree that young people spend a substantial proportion of the time online. So the question arises again: are they also interested in health matters? We have this one study, this YEP study that I showed you before, and this is a study that I show you now that we have conducted in 2023. It's a representative study. I will talk about that a little bit in detail later. But we have asked the adolescents, so it's 10 to 18 years, quite a huge age span, to indicate whether they look for specific topics regarding their health. And I brought you here the top 3 and the bottom 3. The top 3 you can see is activity, fitness, sports, beauty, and friendship and relationship. So the items were a little bit longer, so I shortened it for the sake of this presentation. And you see on the bottom 3, more medical, more illness or disease-related topics. And of course, it's not surprisingly that young people do not look for those information that frequently. So we also did stratified analysis, especially because we had this huge age range, and we see that older adolescents, 40 years or older, 14 years or older, look more frequently for those information on health. We see gender difference, except for activity and physical fitness, also not very surprising. And of course, adolescents from more affluent family backgrounds use or look for information regarding their health more frequently. These are unpublished findings so far. Another one that I would like to show you is a quite recent finding. This is a study that has been conducted by the Universitätsklinikum Hamburg-Eppendorf together with the health insurance BZgA. And this is the first study that at least I am aware of where they tried to ask for AI chatbots in the context of health. And the interesting part is that they divided the sample into a small group of those people who have at least mild symptoms of depression as assessed by the PHQ, and those who have no depressive symptoms. And as you can see here, the blue ones are those with depressive symptoms, at least mild, and they use AI chatbots much more frequently. For example, when they feel lonely, when they want to take off negative feelings, that they assess that the chatbot understands them much better than a real person, or that they would tell the chatbot things they would not tell anyone else. And this is especially important as we have, at least not only in Germany, but also in Germany, we have a gap of the psychiatric ed and help support system. So young people wait up to 18, 20 weeks before they get a psychosomatic, but psychiatric or psychotherapeutic help. And of course, those digital tools will help in the meantime. I'm not talking about quality at the moment. I'm just talking about the usage of those tools. Okay, we have a little feeling that young people use digital media quite often and that they use it for their health matters. Let's dive into a little bit into dis and misinformation. I'm pretty sure you're all very aware of this huge range of terms used here. For the sake of this presentation, I'm just looking at mis and disinformation, and to have that clear, when I talk about misinformation, I talk about that the facts are used wrong, but not with the intention to harm other people. This is more what defines disinformation, when false information is intendedly used to mislead in a way, also with the aim to do some harm. There's one review that has been published in 2022, which received some attention, published by colleagues from WHO, which is a review of review. And first of all, they wanted to find out how frequent are mis and disinformation. And the range of mis and disinformation is quite huge. It's not that we can say it's this frequency, this percentage. So it depends a little bit on the topic, As you can see here, for example, for vaccine, the proportion of dis and misinformation ranges from 1% to 51%, quite huge range. You see, for example, for pandemics in general, for up to 60%, and communicable diseases, specifically on the source of YouTube, between 20 and 30%. What can just summarize here, that the proportion of misinformation can be quite high. Another topic was of this review to find out more about the effects of mis and disinformation. You can see 10 reviews address that topic, and you see that the effects of misinformation range from behavioral effects, like not getting the vaccine, or to decide not getting the vaccine, also the willingness before the behavior, but also some mental health issues like increasing fear, panic, stress, up to mental disorders. We need to look into the review again what that specifically means, but you see some mental health consequences of mis and disinformation. However, this review focused on adults only, so it tells us nothing for kids and young people. So there's a gap of research, I can already say that at this point, but there is one framework quite recently published in 2023 from Amazon, which is the misinformation and recognition response model. And this model is what I would like to, it's not super sophisticated, but it would help a little bit to, as a starting point for on research, or at least to use to structure the research that is out there. I will present you an adapted form by Kops et al. Because Kops et al., these are colleagues from Münster, University of Münster, who conducted a review, very substantial, very huge one, and they used this adapted version. And as I will tell you a little bit more about the Kops review, I will use this adapted version. So first of all, this model wants to explain the ability to recognize false information or misinformation. Let's say yes, no. And if you recognize misinformation, that would result in direct responses. For example, cognitive responses, you believe it or you don't believe it, this misinformation, or you ignore it. You might not believe it, so the probability is high that you ignore it in a way, or you believe it and ignore it anyway. It could be possible. Then you have behavioral responses like sharing it, liking it, counter-arguing, flagging it, reporting it. These could be direct behavioral responses. Before misinformation recognition, of course, there are a couple of influencing factors that might determine the ability to recognize those misinformations. And here the authors distinguish between message-related factors, for example, the claims of those messages. Is this political? Is this other topics that are addressed? The sources where this information come from. Of course, social media might be a source where people are more skeptical compared to more trustworthiness platforms and sources. The format and style that is used, for example, sensationalist headlines that are used, could be fall under that variable. And of course, individual factors, dispositional would be age, gender, etc. And situational could be something like the setting where you are confronted with information. When it would be a more formal setting, you would maybe recognize false information more directly than in an informal setting. Also regarding the people who are surrounding you, for example, the peer group, etc., could be relevant factors here. And finally, the model also defines some consequences or distinguishes consequences. And here's some overlap, as you can see, because they are direct responses on a cognitive and behavioral level, and we have consequences also on a cognitive and behavioral level. So my interpretation is more that it is more the proximal effects and more the distant effects as consequences mentioned here. So for example, cognitive consequences would be attitudes towards a certain topic. I will tell you about this in a short while. Misperceptions on a certain topic that would have maybe a direct consequence for behavior. Effective outcomes, of course, quite clear. Emotions, mood or feelings in behavioral. An example is given here, voting behavior, as we have not much evidence out there concerning health-related topics. So you see it's the blank space here on the bottom of the slide. And the authors also say, of course, now it's relevant, do we have prevention and intervention activities that might have an effect on the ability to recognize misinformation? I will not focus on that very much, but I will focus on that, but not given on the results of this review. So this is the model. I think it's quite interesting to at least structure a little bit on research. And before I dive into the review by Kops et al., I just give you some findings. Some of them come from Germany, and this is a finding from 2020, from the early start of the COVID-19 pandemic. You might know this. This comes from the Vodafone Foundation, where they did a, I think it's representative, a survey with 14 to 24-year-old young people, adolescents and young adults, concerning how often they are confronted with wrong or misinformation, or at least information that are kind of misleading. You see here, does it work? Yeah, it works, super. You see here, these are the 76% of those who said that at least once a week they are confronted with misleading or wrong messages. And when you look at this, this is on a daily basis. These are almost 30%. So a quite high percentage. And if you see here and compare that with the years before, so the numbers on frequencies are rising. And this was 2020, in the early start of the COVID-19 pandemic. Another one comes from the PISA studies. This is PISA 2022. So it's slightly different because the items that you can see ask for a little bit more for the subjective competencies that pupils here, 15-year-olds, might have. But the first item is interesting. I trust what I read online. And what you see here is that only around one third, trust what they found online. So they're quite skeptical, you could say, on the other hand, and they're more skeptical compared to the boys and girls in the other OECD countries. I will skip the rest and will give you another study. This is HBC. You might know HBC is the Health Behavior in School-Age Children study, which is conducted in 51 countries worldwide. And here are the results from Finland. It's a representative study for 11, 13, and 15-year-olds. And here this paper dealt with online threats. Different kinds of online threats. And one kind of online threat was misinformation. Not only health-related misinformation, but general misinformation. Also, these are subjective assessments or not objectively. So here, if you summarize them, these are more than 50%, 56% of young people who say they are confronted at least weekly or daily with misinformation. And the interesting part is here, that those who are frequently exposed to misinformations also reported lower physical and mental health. You see here the odds ratios from the regression analyses. So it's quite substantial here. And I show you this one because we do not have much studies that focus on health information and their consequences for child and adolescent health. And specifically, no or almost no studies coming from Germany. There's really a research gap on that. So I said I will go a little bit into the review by Kops and colleagues. It was really a massive review. As you can see here, 151 studies have been incorporated in that review for the age group of 5 to 25 years. So it's not only adolescents, but also young adults. And first of all, you see the responses and consequences. So the first part is about the factors that might influence the recognition ability and the responses. So this is just to show you that 59 studies deal with individual factors on the dispositional level or on the situational level. And you see, I marked some of them in bold because this is my personal reading of the work is when I marked it bold, this is where I see really there was a kind of homogeneous result in it. And I could find it with the confidence. You see, it's 7 studies examined confidence, and they were quite homogeneous, saying that when people are more confident in their abilities, of course, this will lead to better, not only better response, but to better recognition of misinformation. Same goes for media literacy, critical thinking. Health literacy was also mentioned, but only in one study, so it was quite homogeneous. education, of course, the higher the educational status, the better the ability to recognize false information. Political orientation is quite interesting. We have talked about that yesterday, and the result here was slightly towards the tendency that more liberal political orientation was associated with a higher ability to recognize false information. And this goes hand in hand with other studies that we've conducted together with colleagues from the US. We could discuss this later. So situational reading time, when of course people have more time to critically screen information, then of course the ability to recognize false information rises. Young people, the frequency of exposure, of course, when they're exposed to false information very, very frequently, then it's hard for them to detect those misinformation. The formal environment, the more formal an environment gets, it seems it's only one study. You need to be cautious of that, but in this study, it appeared that the more formal an environment gets, the better the recognition of false information. For example, the school field could be one of those formal requirements, formal environments. So message-related factor, you see, this was quite heterogeneous. I don't find any very consistent result regarding that, but this has been examined in these studies. But the more emotional those messages are, the more typos and errors are, the higher the skepticism, of course, regarding the content. For example, sensationalist headlines, I said that before, were associated with higher recognition of misinformed information. And here the source, credibility of the source, you see only one study, a little bit cautious with that, but it seems that it plays a role for adolescents. So let's focus on the middle part, which would be the recognition of misinformation. And as I said before, you have to keep in mind, this is not a review that focused on health-related topics. So it was super, super broad. Also political issues and all kinds of different issues. And you see the range of those recognizing false and misinformation was super high, between 7% and 88%. But the authors emphasized that only 3 studies could be found that exceeded 80% rate of recognition of misinformation. And interestingly, this really distinguishes this kind of research from the health literacy research. We see here performance-based tests that are mainly used, because we mainly use subjective assessments of health literacy, and which of course raises the question, this could be of course more valid what is assessed here. So, and here are the direct responses. Again, we have 36 studies examining beliefs and interesting, or if people believe in those false information and misinformation, with very heterogeneous results. I think it's almost half-half of studies showing that people believe young people believe misinformation, and the other half say they don't believe in misinformation. But it seems this is what I read in these 9 studies, that they tend to ignore false information. And with regard to the behavior, it's also quite heterogeneous regarding if they share, there's a tendency toward that they do nothing. Even if they recognize false and misinformation, they would just accept it, or maybe sometimes they delete it. This is why I marked it in bold, but very unlikely they will report it, they will counter-argue, they will be active, kind of. This is, the studies showed a little bit that direction. Finally, the consequences. The consequences, again, please take into mind, this was not health-related. You see all kinds of cognitive, behavioral, and affective consequences. For example, attitudes and perceptions. For example, with regard to immigration and with regard to climate change. This has been kind of assessed in some studies, that misinformation had a negative effect on the attitudes regarding immigration, political issues, or climate change. Or also resulted in low political interest. Quite homogeneous is the effective consequences. So it's quite clear that they result in negative effects. And you see here the list. But it's not that much. 8 studies from 159 studies. You have to keep in mind these were 151 studies. So it's not heavily researched at the moment, especially not for kids or adolescents. And behavioral, even less, 7 studies. And you see behavior-related consequences, change of news engagement pattern, that they change a little bit, how they look for information, for the good or for the worse, could be both, and how they use COVID-19 prevention measures was also one of these outcomes examined. So I think it's a very good starting point, this review, although it is not health related, because it gives us a good impression what's out there, but it also is quite clear that not much public health research is out there. We need to focus a little bit on that, especially also for Germany. There's not much out there. No, this direction. Good. So now to the strategies. I said I will broaden a little bit the presentation. So I'm not focusing only on misinformation, how to deal with misinformation, how to fight against misinformation. So I will instead, and you're experts in that, in the digital determinants of health. Here's the definition by WHO, refers to any factor rooted on digital world that can directly or indirectly influence or affect health and well-being. And something that comes from Bremen, of course, you know that, is the digital rainbow. And I use it quite often because it makes very clear that digital determinants are not only rooted in the individual, but more in the systems and the wider layers that follows the individual. And this is, for me, it's quite important, because when we talk about individualization, very often we tend to narrow it down to the individual responsibility. And this figure shows it quite well that this is not the case. There's a Lancet Commission who emphasized these 3 digital determinants, which is all applications of technologies in health systems and healthcare. This is everyday tech use that can influence physical and mental health. And it's the digital ecosystem, so the wider environment, you could say, including, for example, data, AI, security, access questions, for example. And the authors here, Holly et al., they proposed kind of strategies or recommendations how to fight these or how to address digital determinants, especially for children and adolescents. The first thing they suggest is to mitigate the negative impact of children's use of digital media. And the recommendations that you can see here are as follows: regulations and laws, digital health and civic literacy support services. The second one, and also the third one is quite close, is to reduce children's use of digital media or to delay the use of digital media. And here we could talk about digital features, device-free spaces, age restrictions, which is very high on the political agenda of so many countries at the moment. So these are suggestions. These are available. I'm not able to focus on all of them. Yeah, I don't know why it's not there. But normally there was a kind of highlighting what I would like to talk about next. So you will see. So you don't need the highlights, just be surprised what I'm talking about. The first thing, of course, is health literacy. So health literacy is something that is very much in the core of what I'm doing, or I did in the past years, but in a critical thought, it's very much overestimated, to my feeling, what health literacy can really do in this regard. But health literacy, of course, one of these strategies. Let's dive into it. You all know the definition of health literacy. This is the one from Christine Sørensen and colleagues. This is based on a review published in 2012. Where they summarize all definitions out there, and they say it's the motivation competencies to access, understand, critical appraise, and use information to make everyday decisions for one's own health. So these four core competencies. Since 2012, so many, let's say, domain-specific sub-concepts of health literacy emerged. And there are much more than these one. I would like to focus on digital health literacy. Digital health literacy is quite similar. So we have these traditional dimensions of general literacy, finding, understanding, evaluating, but we also have these domain-specific digital skills. And what I mean with that is what you can see here. We've done a study 2022, 2023, where we used these dimensions of digital health literacy that come from Oh, I forgot them. What are the authors? Give me a second. It will get back to me. Van der Vaart and Rösser. Now they come. Yeah, it's the one from the Netherlands. They have developed the digital health literacy instrument, and they use these 7 dimensions of digital health literacy. It's more than just finding. It's, for example, also protecting privacy. Is how they add their own content for social media, for example, because they do not only passively receive information, they also give information. So I already mentioned this study that we have done in 2023. It was a representative study, and the interesting part is that we did a community sample. So we used 300, almost 400 trained youth interviewers. So we trained them, or the company we commissioned trained them, and they did the interviews with young people. So that ended up in a representative sample of almost 1,500 young people. These are the percentages of digital health literacy, especially problematic and inadequate literacy. We use different cutoff values than usually are used for the HLS-EOQ, for example, more driven by content interpretation of the response options and not the cutoffs. You see that we have around 35% of young people having a lower digital health literacy. Specifically for these dimensions, the most difficulties could be found: protecting privacy, navigation skills, and evaluating reliability. You see more pronounced for girls, but only for operational skills. Especially younger age group had a lower digital health literacy. This is interesting. We could discuss this later. And of course, for people with from lower affluent family backgrounds. It's interesting. We talked about that yesterday with Hayo. Hayo was involved in one of the studies that has been done with the German health insurance company in 2020. And these are the darker colors with an adult population. And I've just mirrored with our results. And you see that young people tend to rate their abilities higher compared to the adult population. Of course, take into consideration the timing of the studies, but it could be 2 reasons. Maybe the young people overestimate their own abilities, could be, or the other way around, they are much more familiar with digital devices and would think they are more competent. In fact, we do not know. Maybe it's both of that. We also ask in this study, do you learn those skills in the school? So we post own questions for each dimension, 1 question with examples. And you see it looks a little bit, the difference looks higher as it actually is, but you could see that around 50% of the pupils we asked say that they learn those skills in school. And our regression analysis showed that it is less frequently learned for pupils with dual migration background, for pupils with low affluent families, for younger, and interestingly, this is a system issue, where when they went to schools with a lower digital equipment, for example. So there's room to improve. I will skip this, although it's interesting, it's HBC, but I would like to show you this at last, because as I said, we have a tendency in health literacy research to individualize those things. This is the term health literacy. It's a competency term, but of course it has not only something to do with the competencies. This is not a very old, but an older study that we've conducted in Hesse, in the federal state, where we asked school principals to give us an indication how they have implemented the health promoting school. HPS stands for health promoting schools. And we wanted to see whether school principals play a role in implementing health promoting schools. And you can skip a little bit this one, the first block, but we would like to look at block number 2 and 3. And you see here when they have low attitudes towards the health promoting schools, when they perceive their competencies regarding supporting health promoting schools as low, then this would result also in lower implementation. And you see, it cannot actually so much, to be very honest, the health literacy, but it was significantly as well. So it's also how what kind of conditions are created in the school, and this seems to depend at least a minimum amount also on their health literacy. So I wanted to tell a little bit more about game-based approaches because this was one of the recommendations that I showed you to provide alternative ways to entertain children. So this is what comes from the Lancet Commission. And of course, one way to entertain kids a little bit more and to fight against misinformation would be to use games. I will skip that a bit, but I would like to show you just this slide. This is an intervention that is based on the inoculation theory. We could dive into that. And this is quite interesting because it's a 5-minute choice-based browser game that addresses the commonly manipulation techniques that are used for misinformation. In this case, fear-mongering using fake experts in spreading conspiracy theories. I've played that a couple of times with my students. It's not any longer available. During COVID-19, they could reach 1.5 million people with this game, and they've evaluated this. You see a 3-arm evaluation design: those who received the intervention, those who just looked at infographics, and those who played Tetris. And you see that it had positive effects on the perceived manipulativeness of misinformation. They understood more about the power behind and the techniques. They had more confidence in spotting misinformation, and they also had a higher willingness to not share misinformation. So if you want to play, these are still available. Other games that go in the same direction. I can really recommend Cranky Uncles, quite funny. And I will skip the other game. This is an own game that we have developed. We have talked about that. And this is important for me. I hope you give me maybe 2 more minutes than you showed on the card. Because the last strategy that is defined or recommended by the Lancet Commission would be to delay or reduce the use, and this could be by age restrictions. And this is high on our political agenda. This is why I took it for this presentation. You know, of course, the National Academy of Science, the Leopoldina, has published an expertise last year, and they got it quite right. They said we have a kind of conflict because we need to find the balance between protecting young people from potential threats posed by social media, and on the other hand, we need to empower young people to use social media. This is quite difficult to find this kind of balance. And at the same time, they said in this expertise, on the other hand, where robust evidence is yet lacking, we apply a precautionary principle. What they say is, of course, they made some recommendation, but they said we have a gap of evidence. And the evidence or the recommendation they gave is, I just give you this one: age restriction on social media, minimum age 13 years, parental support, and this one is important. I will show you in a second. Let's focus on this part, the robust evidence. I think this is our responsibility as public health researchers to provide this kind of evidence. Just to give you a very brief, some snippets, that the evidence is not quite clear. The first one is this one, Ferguson, last year, meta-analysis of 46 studies, cross-sectional, longitudinal, that showed no substantial association between social media use and mental health. And they also stratified their analysis and could also find no effects or no substantial results. The second one is a longitudinal study from the UK. Of course, you can criticize the subjective assessment of social media use, but after adjustments, they could not find any association between social media use and mental health. And the last one is from us, from the HBC study, is of course cross-sectional. We need to take that into consideration, but we looked at the relationship between digital media use and loneliness. And there are 2 hypotheses. The one is the stimulation hypothesis, which means you use digital media, and this would result in lower loneliness. And we found support for that. When you interact on social media with close friends, this was associated with lower loneliness. But we found also evidence for the displacement hypothesis, which means problematic social media use. And when you have only online interactions, that increases loneliness. So I'm telling you that because the evidence is not clear at the moment, not that clear as we would like to have it. So we need to invest a little bit more. The other question, as the 3 slides left, is which intervention is the right intervention? Even that we are not sure about that. This is I know it's a narrative review, but it's the first indication because they looked at the different types of interventions. So therapy-based, media literacy, and social media limits. Yeah, narrative, quite clear. But they argued that social media restrictions without providing alternative coping strategy may not yield long-term effects, especially if you don't provide anything else. And there's also kind of limiting evidence. And there's one study that you might be aware of. It came from Goodyear last year, the small school study, where they tried to examine whether restrictive school policies, for example, if you ban smartphones from the school, would that lead to beneficial effects on smartphone use? And this was not the case because they compensate for it when they're out of school. So it's not that super easy. This is what I wanted to say. And this is now the last one. It's also important because it was one recommendation by the by Leopoldina to think about how social media are used. So what kind of features do they use? And I think this is a point that is not sufficiently addressed so far. This way, sorry. This is from New York Times. This year, YouTube accuses TikTok of addictive design. And this is exactly what I would like to make the point. The addictive design methods and features are not well understood so far, especially with regard to the consequences for mental health. Although it has been kind of reported, Montag's German researcher has analyzed the addictive features of social media. And addictive, what could it be? For example, the autoplay button. You start YouTube and it directly starts. Or the infinite scrolling. You scroll and scroll and scroll, and it's very hard for you to stop consuming those kind of information. And this is also important for misinformation. The more you are involved in social media, the more misinformation you are confronted with. So my point is we need to dive much more deeper into the addictive design of social media, for example, and understanding their effects not only on mental health, but maybe also on misinformation. And it's not only about blaming social media. This is just an example, and this is the last point here. This is YouTube. You might have heard about YouTube Health, the strategy that is used. This is just an example. Content creator, in this case, the Foundation of Health Knowledge, can be approved, certified, kind of, and then they get these kind of badge. This is not very interesting, the badge, but more interestingly, the algorithm pushes the content of those certified content creator much more. This is something we need to think about a little bit more. So the very last slide. So what I have talked about. So I hope it came clear that young people are very interested. I'm saying that because in the past we always said young people are not interested in health because they are healthy. This is not the case. They are very interested in their health and they are seeking for health information. There's a kind of lack of research in health-related information seeking behavior because we mainly look at the topics they are interested in, but health information seeking behavior is a whole array of research, not only the sources, but also their motivation behind for whom they are searching for information. Second, people are very much confronted, especially young people, with mis and disinformation. Their detection ability seems quite limited so far, but especially for the German-speaking area, there's not much research out. We need to focus on that, especially when we take, for example, the misinformation response and recognition and response model. That was the sequence. It provides us a very good starting point for own research. Then I talked a little bit about health literacy. Although I'm doing a lot with health literacy, we need to be aware of the limits of health literacy, especially when we bring it down and nail it down and say this is an individual responsibility, it's an individual competence. So we use the digital determinants model to look at the more broader layers of determinants. And finally, I talked a little bit about limits and age restrictions. They are, of course, important to discuss about, but as I said, my perception is that much more research is needed to get a better picture, to dive much more deeper. And I personally, this is something that I find very interesting to look at. So thank you very much for your attention.